Oh! Ow! I already had a knot. Oh, man. Glad my song ended right when I started. That's gonna be loud all day. Doing this before I go to work. Poggers? Does this still work? Yay! Where am I? Me. Hello. Hello, hello. Is that loud? I can't tell if that's loud or not. That's fine. As long as I'm louder. You know, as long as I'm louder than it, then it's fine. Okay, so I have exactly 1 hour before I go to work. I have exactly 1 hour. What does that mean? What does that mean is that if anybody remembers, last week I streamed for the first time in like 8 years. And so last week, hello, I tried to take the quiz to be a certified nurse's assistant. I just kicked my desk. Right. Yeah, it's like here. Okay. Right, I have it right here. Woohoo! It's me.
Actually, yeah. You know what? Give me a week. Give me a week.
A week.
Okay, right now.
I failed it.
It's Wednesday,
You
January
can't even see me.
2023 at 2:30. So a week from now would be the 1st of February.
What?
1, 2, 3, 4, 5, 6, 7. Of course, every.
And what's today, guys? And what's today? As soon as I can close out of this. What is today, you may ask? Well, God dang it, you still can't see. What is today, you may ask? I'll show you. It's the 1st of February! Yippee! Yahoo! Wahoo! That means it's been a week! Hold on, I gotta move that bag. I wish I could do it without anyone seeing. Yippee! A week! A whole week! So I have the test pulled up. It's 60 questions, 90-minute time limit, which is fine because in exactly an hour, I have to go to work. And I've already gone through all the questions, not like that, just to see if they're all, you know, eligible to be seen, not against TOS. And they are! So yippee! Medical school speedrun? Pretty much, actually. But the problem is that I did not do a single thing to study. Yes, just a little bit. I did not study at all. It took my friend 4 months. I said I could do it in a week. And I haven't done anything. So, I am more positive than ever that I can do this. And that's the point. Ready? Ready, Freddy? Here we go. Bam. Me, you, the quiz. 60 questions. Number 1. The resident refuses to eat vegetables with meals or as snacks. I think I've done this question. Oh, it doesn't restart. Oh no, but I don't remember. Refuses to eat vegetables with meals or snacks? Stay with them until they eat at least a small portion, have dietary increase to the amount of vegetables on their plate. Notify the nurse of the nutritional status to be evaluated. Hold on, desserts. Oh, this sucks. This sucks. This sucks. Notify the nurse. I can only miss 7. I can only miss 7. This is actual speedrun. A patient is experiencing dark stools. Which of the following conditions is the patient likely experiencing? GI bleed, appendicitis, gastroenteritis, and hepatitis. Oh, oh. GI Joe bleeding. Dark terry stools. I'm gonna use that. Often indicate bleeding in the GI tract. You're performing CPR on an adult patient. Now, wait, should you probably provide CPR? Uh-oh. Oh, I thought this was gonna be the same question as last time. How am I supposed to know how many compressions a minute? Wait, I can think of this. The Staying Alive song, everybody knows that. You do that for a minute. How many in 10 seconds? Ha, 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 ha. Staying alive, staying alive. Ha, ha. That didn't help me at all. 60 to 100. This sucks! Proper compression rate is 100 to 120 compressions per minute, according to the American Heart Association. That's fine. That's fine. We missed one. That's fine. You have a patient that is on the bowel regimen, but he has not had a bowel movement in 4 days. What is your next step? Report this to the nurse in charge. Give the patient orange juice with Miralax. Where's Miralax? Encourage the patient to drink more water. Nothing. This is normal. I thought these questions would be a lot easier. In 4 days. Oh, what is a bowel regimen? Water. Report it to the nurse, of course. Why, as a nursing assistant, why do I take action in charge? This is how I speedrun failing nursing. You have a resident that has specific religious beliefs and has asked the kitchen to not send certain items on her tray. Upon delivering her tray, the resident tells you that she cannot eat this tray because of her religious beliefs. As a CNA, what is your next step? Sorry, the kitchen is closed. Family member and bring food to you. Take the tray out, contact nurse George, you'll be back shortly. Tray the fish, please. It has to be that one. Pizza delivery. I actually goated. 2 unmarried residents are cuddling in the common area. That's just, no. Who cares? Oh, I'm gonna enjoy each other's company. Contact precautions include what? Mask, gown, gloves, gown, mask, gown, gloves, face shield, mask, gown, gloves, face shield, shoe covers. Do shoes count as contact with the floor, or is it contact with the person? Mask, gown, gloves, shoe covers. This sucks. Oh my god. Face shield, shoe cover. It's just gloves and a gown. No mask? Are you coughing on them? I've already missed 3. You have a resident on day shift that is refusing a shower. He has not showered in 3 days. How will you respond to the resident? Tell him he must take a shower so you don't get in trouble for not doing your job. Tell him that you will call his daughter if he doesn't agree to take a shower. Gently force him into the bathroom until he agrees to shower. Explain to him it's his right not to take a shower and you can try again tomorrow. I remember getting this question last time. Do I remember the answer? No. I remember picking this one. And then I remember going, so it has to be this one. It's right to take a shower. Okay, good. Has a right not to take a shower. So you have a right to be stinky. You are assisting a resident with ambulation. Like an ambulance? The patient uses a cane for ambulation. How should you assist this patient? Stand on the same side as the cane. Stand on the patient's weaker side. Stand behind the patient in case they fall. Walk backward in front of the patient so you can see if they fall. Stand on the weaker side. You should know for when I had a cane. I actually do know, so you're right. I was imagining, like, a nurse in my head. Like one of those stock photos where they're, like, right next to, like, the grandma. So I was imagining, like, why would you be on the cane side? It's in the way. Just be on the weaker side. What is the proper measurement for measuring body fluids? It is, of course, fluid ounces. It's fluid. It's, of course, milliliters. And if you get that wrong, you're actually stupid. Because while measuring bodily fluids, you don't measure them in fluid ounces. Because the standard for measuring all body fluids is using milliliters. If a patient is drinking fluid in ounces and you need to chart input, convert ounces to milliliters by multiplying ounces times 30. 1 ounce is 30 milliliters. I can only miss 3 and I'm 10 questions in. I didn't say I had to get it first try. A resident's family member provided them with a pornographic magazine. The CNA should remove all magazine and discard it at the time the resident will notice. Ask them to keep it in the room to avoid offending others. Take it to the supervisor and let the resident know to ask for it when they want to see it. And encourage them to watch similar videos on the internet. It's probably the second one. It's theirs. But don't let others see it. Of course, easy. You have a patient who is sweating, has a low heart rate, fruity smelling breath, and can barely speak to you. What is the next step you should take? Orange juice. Glucose. It's the only one that actually made sense. Me when I ask them to brush their teeth. Which of the following should be included when beginning to reposition a patient higher in bed? Which of the following should be included when beginning to reposition a patient higher in bed? Lower the height of the bed so it is at its lowest position. Raise the head of the bed. Lower the head of the bed. Grasp with the client under the arms and pull them. It should be what? To reposition a patient higher in the bed. Raise head. Lower. Suck the head. I hate you. Actually, you know what? I'm gonna take this. I blocked you on Discord. I blocked you on Discord. You're so mean to me, I blocked you. That's it. I just had to say that. Bed height should be raised to a comfortable working level for nursing staff to increase injury, or decrease injury, of course. I do. I have beef with you. I have beef with you. I blocked you. We're beefing, me and you. What did I do? Oh, and you don't even remember. Of course you wouldn't remember what you did. No, it's whatever. I'm just trying not to injure my client here. Head of the bed should be lowered to prevent work against gravity. Client should not be... This sucks. I hate this test. You have a patient that has recently been to his oncologist. I know what that is. The oncologist informed the patient's daughter that the patient's cancer is back. The daughter informs you of this, but asks you not to tell the patient. How would you approach this situation? Do not tell the patient because the daughter asked you to. Encourage the daughter to inform the patient of the diagnosis because the patient has the right to know. Tell the patient's daughter that although she is wrong, she has the right to withhold information from the parent. Tell the patient's daughter that she must inform the patient of his diagnosis. You report it to the adult abuse hotline. It's probably that last one. This is not a nurse. Peep this right. Oh! Encourage the daughter to report the patient of the diagnosis because the patient has the right to know. You can just withhold it? This sucks. I hate Minion Mail. I actually hate Minion Mail too. Ugh. 3, 4, 5, 6. I can't miss one more. This is sucky. You're performing CPR on an adult patient. What is the correct depth per compression that you should use? 1 inch, 2 inch, 1.5 to 2.5, and 2.5 to 5. Compression is that? 5 inches down? Ah, I'm gonna break your ribs. She left? Good. Yeah, I'm beefing. Good. Let her leave. Oh, it has to be 1.5 to 2.5. I just feel like 2 is too long. I've already failed. I've already failed. I've already failed. Two's in between the numbers? Yeah, you're right. But it's just 2. You can't go 1.5. You can't go 2.5. There's no room for error here. There's no room. If you make one mistake, they take your certification from you. I hate you. I hate you. I hate you, Mel. You right there. I got a ruler. I've already failed. I already failed. This is so annoying. This is so annoying. I already failed. This is. Oh, it's so frustrating. And so we're gonna take this certified nursing assistant test today, guys. That's right. We're doing this first try. Because I did this last week on the 25th, and it's been one week, and I said I'd do it today, so we're gonna do it. I've already checked through all of them to make sure nothing is interesting is going on here. So that's what we're gonna do. All right, question 1 out of 60. One of the residents gets confused at night and wanders into other residents' rooms. Request for an order for restraints. Use the linen chart to barricade the path of the other rooms. Ask the nurse to ask the doctor for sleeping pills. Provide companionship and supervise the residents' movements. I hope you get banned from every hospital. Yeah, well, watch me pass, nerd! Bam! This is literally so easy. You can't restrain people. It's against the law. Probably. Which of the following should be included when beginning to reposition a patient higher in bed? We already know this, baby. Just lower the head, give them a little bit of sloppy, and it's fine. You have a 75-year-old patient that has multiple bruises in different stages of healing to the torso, arms, and back. What is the next step you should take? Report possible abuse to the abuse hotline, Adult Protective Services? Nothing. It's normal for older adults to have bruises as their skin is more fragile. Report the possible abuse to the police or nothing. The patient is probably on blood thinners, so bruising of this nature is normal. What? What? It probably was the first one? This is literally so easy. This is actually so easy. You're caring for a patient that tells you, I overheard the nurse telling my roommate that my roommate has cancer. Is he going to be okay? What type of cancer is it? You know you should explain to your patient that his roommate's health is confidential and encourage your patient to speak to his roommate about the diagnosis of his cancer. Yeah, that one's just right. There's no need to read the others. I'm going to become a nurse just to flex? I'm literally flexing on all of you. What's the problem here? You have an infant that you are carrying on for your unit. What is the most accurate way to retrieve a temperature on this patient? Oh, it's probably rectally. Yeah. The resident's room is sloppy, and the resident won't tidy up. Clean the room while the resident is at an appointment. Insist the resident put away all the things he or she will be thrown away. Let the resident know there's some things are a safety hazard and help them relocate and notify the others. Oh, I did this last week. I don't remember it at all. You can't touch their stuff, right? Probably. It's one of these middle ones. Throw it away. Safety hazard, probably. In the way, of course. CNA measures the blood pressure of a client to 200 and 180. I don't know what that means. The client is not in distress. What does the CNA do? Ensure the blood pressure cuff is used the correct size and repeat the measurement. Record the measurement and then record to continue the assignment. Immediately notify the nursing supervisor and measure the client's temperature as pulse complete the vitals test. You obviously gotta immediately notify the nursing supervisor. This is so annoying. Ensure the blood pressure cuff is used the correct size and repeat the measurement. Oh, so I'm just wrong here? This. He always takes his temp rectally. What is the proper measurement for measuring body fluids? Actually, milliliters. You're stupid if you don't know that. If you're using a pulse oximeter on a patient, you should know a pulse oximeter is used to measure what? OxyClean, oxygen. It measures the amount of O2 in the patient's blood. If you have O2 in your heart, you're probably dead. The care plan for a client indicates they should be repositioned every 2 hours when in bed. Which of the following is the rationale for this nursing intervention? Increase client comfort, provide the opportunity to check in with the client, decrease fall risk, or prevent skin breakdown. They should be repositioned every 2 hours. Which of the following is rationale? I don't know. My ball's in her face like she playing dodgeball. It's like so rough, she need to latch onto the wall. You're right. Why am I taking the quiz? You're right here. Probably increase comfort. Prevent skin breakdown. Of course. Which of the following are important for the care of the diabetic patient? Giving the patient a heating pad for his feet when they're cold. Soaking his dry, calloused feet. Soaking his dry, calloused feet in a warm tub daily. Keep his feet dry and warm with dry, clean socks. Ensuring his toenails are always clipped short for cleanliness. Probably socks, I guess. Easy. Which of the following is the best way to prevent the spreading of germs? Wearing gloves, wearing a mask and gloves, hand washing before and after, wearing a gown. Hand washing. I know that's important. Trench foot. Become a Twitch stream rapper and have public beef with me? I'm actually down. You'll see me drop bars like there's no tomorrow. I would actually flame you into the next set of hell. You've got nothing on me. So good at washing his hands is actually true. I know. I learned this in a hospital. You notice a resident screaming at a coworker. What should the aide do? Yell at them to stop, call the charge nurse, reply restraints, or none of the above. You obviously gotta call the in-charge nurse. I'm doing so good. You're assisting a diabetic patient with eating and he only finished 25% of his meal. What should you do? You obviously have to report this nurse. You have to report this. I'm not the nurse. I'm a nurse assistant. You're providing education to a female resident about proper perineal care to promote self-care. You explain to your patient that it's important to wipe from the front to the back to prevent bacteria from spreading from the rectum to the what? Urinary medius. I'm even gonna use this in my rap to destroy you. Producing these bars faster than Willy Wonka, you better watch your urinary medius, okay? The medius houses the urethral opening. I can tell Melanie actually wipes back to front. Watch your urinary medius. Which of the following in the CNA anticipate participating in a part of a client care during the shift assignment? Administering intravenous medication, dressing a wound, assisting with bathing. Probably bathing. I love bathing. To my Willy get Wonka? I went top to bottom? Oh, you're performing CPR on an adult patient. What is the correct depth for compression? It's 2 inches. This is easy. Wipe side to side and scrub like I'm brushing my teeth. You assess your patient and he has a fever of 102.1, HR 101, RR22. The patient appears sweaty. He most likely has what? Allergy? Infection. Allergy. Infection. Ha! Upon finding some unlabeled pills in the nightstand, the CNA should pop them. Provide water and insist the resident take them as soon as possible. Discard them, leave them alone, notify the nurse immediately. Of course, they're unlabeled. Why do you keep saying trench foot? Which of the following happens when a patient has a stroke? Pee-pee. Foam at the mouth. Roll their eyes back. Have a drooping of one side to the face. I thought it was all of these. Well, this one doesn't say may, so. How can you say which of the following happens and then say may have a drooping? This is a seizure. Never mind. I know what I'm talking about. I'm done with you guys. I'm not reading chat anymore. A resident's family member provided them with a magazine. Obviously, you just keep it in your room. Easy. I've seen this question like 8 times. You have a resident that has specific religious beliefs about the kitchen. Obviously, take the tray out, contact the nurse, bring back a meal that's in line. Patient is lying in a supine position. I know what that is. In what position is the patient's bed? Supine. Let me think about this. Supine. Peen. Supine. Pine. Fine. Fine 90 degrees. No. Fine flat. Fine tilted. Fine 45. Tilted like towers upside down at 30 degrees. You're telling me a peen made this soup maybe in a position it is actually 45 degrees. Damn it. It's gonna pick flat. Oh, that's so stupid. Huh. 4. I can only miss 3. The resident wants a copy of their medical record. Make a copy of the record and give it to him. Inform that copies cannot be given to the residents directly. Notify the resident's family about the request. Provide the record release forms and advise the supervisor. Probably supervisor. Yeah, I feel like I'm not in charge of that. I dip my peen in my soup to know how hot it is. You're performing CPR on an adult patient. At what rate should you use to properly provide? It is actually 100 to 120. I'm actually not certified. This is actually contact precautions, easy mask on gloves. Nope, just gloves and a gown. Face shield and shoe covers, which is actually just gloves and a gown. No mask. That's right, obviously. You have a patient that is on bowel regimen and has not a bowel movement in 4 days. You obviously got to report this to the nurse in charge. That's not normal. It's constipation. You have a resident on a day shift that is refusing to shower. All you got to do is explain to him that it's his right not to take a shower. You can try again tomorrow. This is so easy. Bed making technique includes eliminating wrinkles into sheets, and CNA should know this technique assists to prevent sores, pressure sores, ensure the client is warm, minimize the need to remake the bed frequently, minimize the need for additional blanket. Eliminated wrinkles in the sheets. What? Pressure sores, obviously, because if there's wrinkles, it'll hurt you. It's like when you lay down in bed and then take a nappy wappy, and it's like the hardest nappy wappy of your life, and you wake up with like little lines on yourself. I assume that's what that is. Did they teach you that in your kitchen sanitization class? Absolutely. We're halfway there. The certified nursing assistant understands that volunteering in the community, joining a senior citizen group, and exploring new hobbies and interests can help make the elder person's life more fulfilling. These activities can do what for the resident's outlook? Gives them a sense of purpose. Obviously. Yeah, true. You, as the CNA, right after this quiz I will be, see a nurse give a patient milk, which the patient is allergic to. This nurse has been made aware of the patient's allergy multiple times and has been asked to stop giving the patient milk on several occasions. What is your next step? Nothing. This is not my concern. Tell your nursing supervisor, tell the nurse that she shouldn't give the patient milk, or tell the patient that you are sorry they got milk, but that is all the kitchen has had to drink. Tell my nursing supervisor. I'm not involved in this. Chef Doug says that it's cleaner than using your finger. The nurse has a diarrhea fit. CNA is asked by another CNA to help get a resident up on the floor, but is not told what happened. CNA should help the other CNA report the event to a supervisor to us because everyone should respect the patient confidentiality. Wait until the end of a shift to ask the other CNA. Ask the resident what happened. Probably report it. Of course, yes. You report everything. A resident is hitting and kicking you while another CNA are trying to provide care. What should you do? Sit on the patient's hands until the nurse arrives. Yell for the nurse to bring a sedative. Ask the second CNA to get the nurse. Tell the patient they better stop hitting and kicking. You better stop. Ask the second CNA to get a nurse. That's fine. We're learning. Obviously, why? You all know why? Yeah, true. You have a patient that has recently been to his oncologist. Inform the patient's daughter the cancer is back. We know this one. You encourage the daughter to inform the patient the diagnosis because the patient has the right to know. You can withhold information. It's completely legal. The CNA is aware of the importance of meeting the elderly resident's emotional needs. This can be accomplished by regulatory checking on the resident, keeping a call light within reach, and modifications of equipment and use of devices to prevent falls. All these measures meet what emotional need of the elder? Safety and security? Yeah, there's no privacy. You're assisting a resident with ambulation. The patient uses a cane for ambulation. How should you assist the patient? You stand on the weaker side, obviously. Seniors like to make their own decisions and can do so unless they are cognitively declining. The certified nursing assistant is aware that one of the best ways to respect the resident's decision is to do what? Legal counsel, actively listen, ask to speak with their social worker, encourage them to listen to their family. Legal counsel? Social worker? Actively listen. Of course, yes. Yeah. A resident is acting out or having behavioral disturbances. The certified nursing assistant is aware that the action should be taken first. Encourage the family to make arrangements for the resident to live somewhere else. Provide for patient and staff safety. Isolate the resident from all other residents in the facility. Call the police. You probably isolate them. Provide for patient and staff safety, which is what I'm doing by isolating them. This is dumb. What is one reason why performing post-mortem care is essential? What does that mean? There's no need to perform post-mortem care. Performing post-mortem care ensures that staff feel good about themselves. One reason post-mortem care is essential is the body is prepared to be viewed by family or friends. Post-mortem care is crucial in maintaining the dignity and respect of the patient. Yeah, probably this last one. 4, 5, 6. I can only miss one. And we only have 20 left. Easy. You've been busy doing your 12-hour shift and haven't been able to empty your patient's folly bag. Folly, you go right before your shift is over to document output. What output amount would bring caution? It's actually 350, the lowest one. That's a lot. You're returning a patient during your rounds. What is the best way to ensure you do not pull the Foley catheter out? Secure it to the on the inner thigh, bed frame, tape it, hold it. It's gotta be secured, baby. The resident refuses to eat vegetables with meals or as snacks. Notify the nurse. That's not my problem. CNA is assisting a client who is on a swallowing precautions after a cerebrovascular accident. Which of the following should be incorporated into the plan for the care of this patient? Should not be left unattended while eating. Should eat alone in their room? No. Should be instructed to tip their head back as they swallow. That will make you choke. Are needed if the client eats only soft foods. Maybe be not left attended? Oh, thank God. 2 unmarried residents are cuddling in the common area? That's absolutely disgusting. Enjoy your company. Is VMAC a CNA? Not yet. If asked to sign a resident's will, the CNA should agree or refuse any compensation, decline, and notify the family. Arrange for the case management to assist the resident. Get another person to sign. You can actually do it, so it's fine. The patient is experiencing dark stools. It's obviously a GI bleed. If you didn't know that, you're probably dumb. Which of the following interventions should the CNA use to promote skin integrity? Bad bony promises when in bed. Bad bony promises when in bed. Leave Ted's stockings on during the night. Who's Ted? Provide client with additional blankets so they're warm. Side the client up to reposition them higher in bed. Skin integrity. Oh no. Oh no. Stockings? Additional blankets? Reposition higher in bed? Probably pad? You're performing CPR with a second rescuer available to you. You're performing chest compressions. The second rescuer is giving oxygen via bag and mask. What rate should the second rescuer provide breaths? It's actually 1 every 5 to 6 seconds. Oh, I failed again. 1, 2, 3, 4, 5, 6, 7. The second rescuer should know how to do their job, not your problem. Actually true. Actually true. What the heck? Okay. It's 1 every 6 seconds. I said 1 every 5 to 6. That's the same thing. Why does that have to be so specific? If you're like 0.1 of a second behind, they just die immediately. This is stupid. And welcome to the first try of the 60-question CNA Nursing Assistant Test. Add an option to every question. E, literally not my problem. Actually true. Which is what half of these are, actually. It's like, oh, what do you do? Yeah, just tell the nurse. Am I gay quiz when? Every link is purple. Hold on, I'm getting a FaceTime. Oh, this better be important. What the hell? I'm gonna call my friends. It's just, I hope you never be a nurse. You really bad. This, I'll show you. I'll show all of you. What did I do? This is my first try. I haven't done anything yet. Calm down, people. Listen. Listen. I don't know what to say. This sucks. This hurts my feelings. I have 20 minutes left. I have 20 minutes left. And if I can't do this, then we just retry. There's no problem. We just retry. We do it in another week. We do no more studying, because that's stupid. Only idiots study. Right? You hear me? If you ever studied, you're an idiot. I hate you. You're stupid. Anyway. And welcome to the first try of the CNA practice test. Now, I did this a week ago, and I failed. I didn't get past question like 16, and I failed. So, we're going to try it again. I haven't studied at all, and it's been a week. So this can't be that hard. And if you ever fail taking a free CNA practice test, you're probably really smart and handsome. Which of the following would the CNA anticipate participating in the start of a client care during the shift assignment, administering intravenous medication, dressing a wound, assisting with bathing? Obviously, you assist with bathing. That's all I do. That's all I do all day, every day. I work at a bathing store. CNA is asked by another CNA to help you get a resident up for the floor. Is not told what happened. You help but report the event. You always report everything you do. If it says report, you report. Self-report. Among Us. Sus? Everybody type sussing in chat. Thank you. The CNA is assisting a client who was on swallowing precautions after a cerebral vascular incident. Which of the following should be incorporated into the planned care for this client? Not be left unattended while eating. Easy. You're assisting a diabetic patient with eating only to 25% of his meal. You obviously report this to the nurse in charge. Not my problem. You have a patient that has inconvenience who has incontinence. Who wears briefs? What is necessary for patients with stress and incontinence? Who wears briefs? That's cool. I wear boxers. A Foley catheter to keep the skin dry? Frequent toileting breaks throughout the day. Less fluids to keep them from urinating often. Diuretics to help keep their bladder empty. Maybe a catheter? Frequent toileting breaks. Of course, why would I? The cathetering significantly increases the risk of a UTI. But it's not me, so why should I care? You're performing CPR, it's 2 inches. Go any more, you die. Which One Direction member am I quiz? We'll get to that. The patient is bedbound at risk for which of the following? I don't know what any of these means. Is bedbound is at risk for which of the following? Neck paralysis. Atrophy. Certified nursing assistant aware that the resident sleeping more than usual, lack of interest in once loved activities, and withdrawal from family and friends can be a sign of what condition? Depression. Seniors like to make their own decisions and can do so unless they're cognitively declining. You obviously just actively listen. You're performing CPR, it's 100 to 120 compressions a minute. You're a resident that's specific relatively. Take the tray out, contact the nurse in charge. George, you'll be back. You have been turning. This is actually 350 milliliters. Obviously. Which is the following best way to prevent the spreading of germs? You wash your hands. You obviously gotta wash your hands. Hand washing is good and great and awesome. Which of the following represents the correct situation for size and blood pressure? Correct section size for blood pressure cutoff? It's probably the width of the cuff leading circles. I'm in the arm with together probably 25%. Completely in circles. 40. I thought 40%, but that seems low. Why would it be? Because in my head I was like, like 70. You know, transracial Asian affirming eye surgery vlog when? Stop spoiling my content. Later. Oil London inspo board making stream when? I'm continuing. You have a patient who is sweating, has a low heart rate. You gotta take their glucose. I have so much of that. Patient is lying in a supine position. It's actually flat. If you don't know what supine is, bed making technique includes to prevent pressure sores. It's like when you nap really, really hard is what I'm assuming. You're providing prenatal care to a resident with second CNA barges the room without knocking. What do you say? I'm providing care to this resident. Please make sure to knock to respect the resident's privacy. Obviously, I didn't even read the other ones. Certified nursing assistant understands that volunteering in the community, joining a teacher, gives him a sense of purpose. Casey monolid and ethnically ambiguous eyeliner tutorial. Oil. Yeah, oil. What's wrong with that? Ollie. What is Ollie? Oli. Casey Foxeye snatched kawaii sexy dragon lady tutorial. You as the CNA see a nurse give a patient milk. Tell your nursing supervisor. Resident wants a copy of their medical record. Provide the resource and advise the supervisor. You do a breath every 6 seconds because you're stupid. Which of the following is an example of a subjective information? Subjective information. Probably this one. You're providing education of a female resident about proper prenatal care to promote urinary meatus. You have a patient that has recently been on to his oncologist. That's cool. Encourage the doctor to inform the patient of the diagnosis because the patient has a right to know. But you can withhold that. I say that every single time. 2 unmarried residents are cuddling in the common area. That's disgusting. You have an infant that you are caring for in the unit. Which is the most accurate way to retrieve temperature on this patient? Rectally. Upon finding some unlabeled pills on a nightstand, you just pop them immediately. You refer to the nurse. One of the residents gets confused at night and wanders into other residents' rooms. You just provide companionship. That's all you need. Yeah. You have a 75-year-old patient that has multiple bruises in different stages of healing. You report possible abuse to the abuse hotline. You are assisting a resident with ambulation. The patient uses a cane. You just stand on the patient's weaker side. The resident refuses to eat vegetables with mirrors or snacks. You just notify the nurse so their nutritional value, their value. Which of the following happens when a patient has a stroke, may have a drooping on one side of the face? You have a patient experiencing the end of life. What would you expect the plan of care to include? Experiencing the end of life. They're just dying? Range of motion exercise to increase the patient's strength? You just bury them. What are these answers? Ways to prevent optimal comfort in the patient? Prevent forgetfulness? Probably that one. Of course, easy. Oh, this is so easy. Everyone, let's make a soundboard of slurs so Casey can say them, but in our voices. Rizzing up my psychiatrist, cops were called. He's in his Wiggles era? Sway with me, fruit salad, Michael Bublé. Notice a resident screaming at a coworker. What should the aide do? Call the charge nurse. You have a patient that is on a bowel regimen. Easy. You just report it to the nurse in charge. Not my problem. You need to use a Hoyer lift to transfer a patient. The patient is a to assist. You're in a hurry. You bring the Hoyer lift into the room, and the resident asks, are you going to get someone to help you? What should you tell the patient? This guy wants to be a nurse so bad. Actually, no. Just because I think it's easy. Because it took you 4 months. It takes me 1 week, baby. Maybe half an hour, huh? Maybe an hour total. That's all it needs. Safety comes first. Yeah, you just get another one to help. What is one reason why performing post-mortem care is essential? Maintaining the dignity and respect of the patient. What is one reason why performing... I already did that one. I'm going out of my mind. Which of the following interventions should the CNA use to promote skin integrity? Brony. Certified nursing assistant is aware of the importance of meeting an elder with emotional needs. This obviously gives them... is this sense of purpose? This can be accomplished by regularly checking on the resident, keeping the client calm with them. This gives them safety and security. If a patient on a strict precautions, the cafeteria sent her up a lunch tray. What item should you question if it arrived? Oh. Okay, we can do this easily. We can do this easily. What's so common about all of them? Mashed potatoes, jello, and applesauce are kind of like not liquid compared to regular orange juice, baby. Of course. They will require thickened liquids. You are turning a patient during your rounds. What is the best way to ensure you do not pull the catheter out? Secure it to the inner thigh. Measures the blood pressure of a client to be 200, 180, not in distress. You just do it again. The care plan for a client indicates they should be repositioned every 2 hours when dead. This will increase the following rationale for this nursing intervention. Skin breakdown? Probably. Yeah. The resident's family member provided them with a pornographic magazine. You should just tell it to stay there. Music. Uno momento. The kitty cat needed out. Orange juice stream when? Orange juice is mid. Apple juice all the way. Lactose intolerant challenge stream? I'm not lactose intolerant. Caesar salad taste test? Okay, that will destroy me. He left, let's send him a bomb. I'm fine with that. Caesar salad taste test when no bathroom edition. Why are you trying to kill me? Why are you trying to kill me? which of the following should be included when beginning to reposition a patient higher in bed? You lower the head of the bed. You give sloppy when the proper measurement is milliliters. But of course, this is so easy. A patient is experiencing dark stools, GI bleed, gastrointestinal. Patient's room is sloppy and the president will tidy up. Some things are a safety hazard. You better pick the shit up. You have a resident on day shift that is refusing to shower. Explain that it is right to not take a shower and you can be stinky if you want. You assess your patient. It has a fever of 102, 101, and most likely has what? An infection. And this, ladies and gentlemen, and this is the last question. Which is the best way to tape an apical pulse? To the right of the sternum underneath the clavicle, on the back of the fifth intercostal space, to the right of the sternum and the fifth intercostal space of the mid-clavicular line, to the left of the sternum and the fifth intercostal space of the... But it doesn't matter, baby! It doesn't matter! It doesn't matter because we passed already! You see that? 1, 2, 3, 4, 5 is all I missed, and how many can I make? What? 7 total, baby! 7! That means we passed! We passed! We're a winner! We're a certified registered nurse's assistant, baby! Let's go! I'm a little lightheaded. Who? Me. That's right. And 3 minutes to spare before I had to go to work. Bozo, you're literally speaking to a nurse here. Please. Out of my way. Come on. I'm ending stream. I'm ending stream. I'm ending stream. Oh my god. Oh my god. Oh my god. Oh my, you guys can't,